Çalık bekliyorum.
Chap. Hi, my name is Eryannie Mohammad and I'm 44 years old and I'm at stage 2 breast cancer. I've been with them since 10 years ago, and finally when I was diagnosed with this, I had to step down as a preschool teacher and special needs education due to the side effects that I'm having during the treatment and surgery. I'm a preschool teacher and a special needs educator, and being a mom of 3 teenage, aged 18, 16 and 14, I'm very close to my children as I have a passion for children. So that was what I am, a hyperactive mom and a teacher before I was diagnosed. In the early Jan, at the age of 40 years old, I was supposed to go for a routine mammogram. And a week before that, I found a lump during my self-examination check. Though there wasn't any symptom before, there wasn't bleeding or any painful experiences. But after finding out there was a lump, I immediately went to find my general practitioner, which is a female general practitioner, and have a further check. After that, they had actually referred me to Singapore General Hospital for further checks, and that's when I did the biopsy, the PET scan and MRI. And following from that, there are more further checks being done on me. And after a few weeks later, I was given a choice to actually do a mastectomy and a reconstruction surgery. So yeah, I've decided to follow up with that in order to be in my recovery. Frankly, when I was informed of my diagnosis, I was totally feeling blank because I believe that I was trying to register all the information given by my senior consultant on the diagnosis. And later part, the only thing that came across my mind was my elder daughter, because during that moment she was sitting in for her PSLE examination. So yeah, I'm just wondering what would she have thought if she knew about this. I totally feel blank. I don't feel anything at all. I just feel that during that time, I'm just trying to register the information and then thinking about my daughter, and then I just let it be. Yeah, I just let the doctor decide when should I be coming up again to the hospital to do more checks. And the next thing I know, 2 weeks later, he has scheduled me the mastectomy date, and yeah, I'm just ready to go.
All right.
So when I discussed this with my husband, when I come back home, no one knows about this except for my husband. Okay, so we actually keep it quietly from the 3 children, but after much further discussion, I've decided to inform my elder son, because preparing him to get to know the unexpected and helping the father out when I am in the process of healing during the mastectomy surgery. From what the doctor was explaining, it will take like almost 3 months for the recovery. So I'm not expected to move a lot, after the surgery and all that. So definitely someone have to come in to help with the household. So I'm taking up the challenge actually for the boys, the men in the house, which is my husband and my son, to gear up the house chores. So after 2 weeks of the whole journey, I was given a date to meet up with the breast surgeon and the plastic surgery surgeon. So we actually have to meet up with them to decide on which part, and the necessary procedures. So what I've gone through is the mastectomy on my left breast and a reconstruction on the same place, as well as the deep flap process. So after that, I went through 16 cycles of chemotherapy, and right now I am in my 5 years hormonal medication, and next year for review. As a Malay-Muslim woman, I have faced unique challenges in terms of cultural and religious challenges in bringing up the family, especially when it comes to doing the job as a mom and a wife. So basically, it's like more of the wife, the mom, that has to be, doing everything at home. I'm a multitasker. I'm able to multitask work at home, chores at home, but after being diagnosed, I have to literally do one single task at a time. Partly it's because of the energy level that gets low, and I get tired easily. If no one in the family helps me out, I will just simply take time to do one work once at a time. So with me being diagnosed with breast cancer now, it seems to get very hard at home back then. But now I think it's getting better because everyone is playing their roles, sharing the job loads and all that. I do get help from the National Cancer Center for development, for my mental and health development. But not to say that, Breast Cancer Foundation, BCF, has also helped me so much during my first 2 years of being diagnosed with a cancer. They have actually give informations on education resources and support group, which I really thank them so much, because during that moment when I was diagnosed, I was totally blank and at a loss. So the only help that I could get at that moment was being with Breast Cancer Foundation. So yeah, they will do educational talks, and especially on exercise and diet. So that was when it has actually helped me through this journey of breast cancer.
Hi, I'm Adeline. I'm from Breast Cancer Foundation. From Breast Cancer Foundation's perspective, there's been a lot trying to do an outreach to the Malay community. And I think we did a multi-sectoral workshop this year in January, and we published the article in our website, which you can download, in July. And the article will talk about, I think, 4 key things that the Malay-Muslim community is a little bit more afraid of. And I think it's applicable to everyone, but I think it's more amplified within the Malay community. One is the fear of knowing what is unknown. Secondly, I think there's a lot of stigma and taboo in terms of breast health and breast screening. They are fearful of the pain, of doing mammograms. Thirdly, I think it's financial. So people worry about, if I get diagnosed, then how is this going to impact my work and everything else and my livelihood? And of course, lastly, I think most women, but more so maybe the Malay-Muslim women, they always put themselves last. I think all mothers and, generally will always put themselves last. But so then they will not focus on their own breast health, but focus on the family first.
As a Malay-Muslim woman, whenever I do sharing to the public, every time what I heard from them is they have the worries of going through mammogram. So they always describe it as something that is painful, something that they wouldn't want to go through, and not wanting to know what is in them. So they would rather not know. So being an advocate for early detection, I've always did my sharing, and I've always told them that it's better to know early and find a solution rather than to let it just be in you and not knowing how it actually depreciates your life. So yeah, that is what they have always been saying, the fear. So my sharing with them is actually to dispel the worry and the worry of having to go through mammogram. So many, we had so many awareness programs set for them, even to the mosque, even to talk shows, even to the public, community center. There was a vast of awareness being created for this, for my community. But unfortunately, they still do have that fear. And in fact, in the sharing of the Malay channel, like Surya, or in fact Warna, Ria, the radio station, they also advocates to early detection for breast cancer. And we have a lot of artists coming in to do talks, but yeah, it's all about awareness, but I think surely we will get there.
So one of the key things that BCF provides is the psychosocial emotional support to our members. And I think we are secular, so it doesn't matter what race or nationality, we will support you. But one of our key things that we do have is a befrienders program. We try to match people from similar backgrounds and from similar age and circumstances so that the befriender will walk with the befriendee, the newly diagnosed person, to make sure that they know that they don't walk through this journey alone.
During that time when they were actually down, and me myself, that was the first thing I was looking out for, to actually have a support group to in line with whatever I'm going through. And like what I've always mentioned to the people that I shared in public, only a cancer patient would be able to understand what a cancer survivor goes through. So yeah, it's always good to have a support system to be with them, or a befriender in fact, to actually to go through together. I strongly advocate for early detection because being early detected myself, I believe and I realize that it saves my life. If only I have waited 1 week later or later part, I would not have survived because it could just have gone through a further stage.
The other call to action is definitely please do early detection, because it's only through mammograms that we can actually discover a stage 0. So I'm not sure whether you all are aware, but there's such a stage as stage 0. And it's only through mammograms that you can find that, because there will be no lumps in your breasts.
So if you ever found something in you, do not hesitate to just go ahead, meet up with your general practitioner, or even go for your mammogram at the age of 40, and yeah, you can survive.